This is for my pregnant mamas out there. If you are not doing these 3 tests during pregnancy, not only for yourself, but also for your baby, then you need to pause everything else and get these tests done right away. I'm sure you're doing everything right. Seriously. You're probably getting all of your blood work done. You're going to all of your appointments. You're getting all the checks that you need to do. You're getting all of the testing that's happening. But I want you to pause right there and ask yourself the question, is my OB or midwife thinking about my nervous system? Why would I ask that question? Well, glad you asked. The nervous system controls every cell, every organ, every system in the entire body, including pregnancy. So, we need to make sure that we are knowing how our nervous systems are adapting to stress. How are they regulating? Are they resilient? Let's backpedal a little bit and talk about what even is the nervous system. Like I said, it really does control everything, but we really want to I want to take you guys back to like maybe 7th, 8th, 9th grade science here, and we're going to really simplify this. So there are 2 sides to the nervous system, and here's why it really matters in fertility, in pregnancy, in birth, and in postpartum. So let's walk through this. So there are 2 sides to the nervous system. There's going to be the gas pedal side and the brake pedal side, which is simplified. It's really the sympathetic nervous system and the parasympathetic nervous system, or what you may know it as fight or flight and rest and digest. So how I always describe it, and you may have heard other practitioners say this, but the gas pedal is going to be, if there's a bear in the room, you're going to want to fight, you're going to want to flight, right? We want to be able to fight that bear, fight that saber-toothed tiger, you're camping, whatever it may be. I don't want to get too into that, but you could really say a whole entire story about the gas pedal side, right? That fight or flight response. The other side of the balance, if you will, is going to be that rest and digest, that parasympathetic nervous system, your brake pedal. When do you want to be in this? If you're just chilling at home, maybe you're cooking dinner, but your kids aren't running around, it's really peaceful. That's when you want to be in that rest and digest. You're watching a show that you don't really have to think about. That's when you need to have your brake pedal on. I don't want to necessarily demonize the gas pedal side either. If you're giving a presentation, if you are running a marathon, if you're just doing a normal day-to-day workout, that gas pedal is going to be important, right? You want that to be on. You're at work and you need to perform, that gas pedal should be on. The minute you enter the safety zone or the rest and relax and regulate side, your brake pedal should be on. So I want us to get those 2 sides of the nervous system down. There's also going to be 2 sides of our hormones, if you will. And guys, I'm really simplifying this. There's a lot more systems at play, but I want us to truly understand why this test that I'm going to talk about is so incredibly important and why that nervous system as a whole is really important going into birth. So 2 sides of a hormonal pathway, if you will. The one that goes with the gas pedal is going to be the HPA axis. So when I see that bear, the bear is going to send signals to my brain is going to tell me there's a bear in the room. It's going to tell my body. How it does that is it's going to tell my hypothalamus, which is a part of your brain, to your pituitary, also a part of your brain, down to your adrenal glands, right? They live basically on the back side of your belly button, in your back, right on top of the pancreas area. That is going to be telling me that I need to pump out adrenaline and cortisol and all of those hormones that are going to make me go, go, go. On the opposite side, that brake pedal side, what that has to do with hormones is I see a relaxing show. What's going to happen is my hypothalamus to my pituitary, same thing, but that's going to go to my reproductive organs. Big time in fertility, in pregnancy, in postpartum, I'm going to want to have the accurate amounts of progesterone, of estrogen, of all of those healthy women hormones. It also is the same in males too, but we're talking the other side today. And so I'm going to want to have those healthy hormones. That's why, one of the reasons why the nervous system is so incredibly important during pregnancy. We want to make sure that it is regulating and functioning the way that it's supposed to. So that's what our 3 tests also will show us. I will get to that in a second, and I will also show you in, what the scans look like and things. The second bullet point, if you will, that I want to go over today of why tracking your nervous system during pregnancy is so important is going to be something called co-regulation. This is one of my favorite things to nerd out about, and I hope that you'll love it too. But the umbilical cord from us to our baby is not only giving the baby nutrients and oxygen and all the blood, but our hormones are traveling through blood. So whatever I'm feeling or whatever my brain is perceiving as a bear, which I might be in safety, but if I'm stuck on the gas pedal nonstop, not able to access my brake pedal, my baby's learning that too. Through that umbilical cord, through the blood, through the hormones, they are going to match what my nervous system state is. So it's not about us anymore, guys. And if you're a mom, it's never really been about you, right? You're always putting yourself last. But right now, when we look at it through the lens of co-regulation, we're also putting ourselves last again, right? Because we're thinking about our baby and their development inside the womb. If they're taking how we're adapting to stress and they're basically setting that as their blueprint for their nervous system to develop, I want my baby to have the most regulated and adaptable nervous system, and I'm sure you do too, especially now that you know this fantastic thing called co-regulation. So what we do at our office is we use 3 neurological insight scans is what they're called. And I'm going to walk you through and show you each one, what they look like. But we recommend all of our fertility, all of our pregnancy, and all of our postpartum patients to get these scans so that we can see how your nervous system is functioning going into birth. What's fascinating about birth is you have to be able to access both the gas pedal and the brake pedal during birth. How you initiate birth? Brake pedal side, right? It usually happens at night. It usually happens when you're calm. Then to really get everything going and to get baby out, you have to be on the gas pedal. Not only you, but also your baby. Both of you have to have that gas pedal response. And immediately when you pull baby up and baby is laid on your chest, that is when baby will really co-regulate with you with skin to skin contact. They are really mirroring your nervous system response, and both of you should return back to that parasympathetic nervous system state, so that brake pedal state. I really simplified that into 3 phases of brake, gas, brake. What happens when we get to the birth center or the hospital if you're having one of those births? Your body will most likely stall. There's bright lights, there's beeping noises, your body isn't used to that, and so labor may stall. So what we need to teach your body is how do I get back? So that's a gas pedal response. How do I get back into brake pedal so that I am really ready to push this baby out and to co-regulate after? So I'm going to share my screen here and we're going to hope that it works here. Amazing. We're going to go over the 3 scans that we do here at our office. So number 1, this is going to be an HRV scan. What this stands for is heart rate variability. So what this does is it's going to take your heartbeats and it's going to find the variability in between each heartbeat. What this really is a global test to really test how is your health. So everyone should be testing this, not only pregnant women. If you have an Oura Ring, if you have a Whoop, if you have a Garmin, if you have an Apple Watch, chances are that you're probably testing your heart rate variability from day to day. What this test does, it's not only going to take your day to day, but it's also going to take a global measurement on just how are you functioning in life, not just day to day, but overall months, years. How are you adapting to stress that is coming into your life, right? We can't choose what stress happens within our life. We can't choose if the bear is in the room. What we can choose is how we take that in, process it, adapt to it, and hopefully throw it out. We don't want to store the stress. When we're storing stress, that's called subluxation. And that is why you see us, you see the chiropractor, is because we need to retrain your body how to take that stress in, process it, and kick it out instead of store it and hold on to it for so long. So this HRV is also going to tell us how is your body battery. So this axis here is your body battery. So right now, this one is starting at about a 70%. So that's like if I woke up and my phone started at 70%. probably not going to last me all day. I would love to be at 100. 70 is pretty good, but say that you're starting at 50, you're starting at 40, you're starting at 30. And then from here, side to side, this sympathetic we just learned about, gas versus brake, right? So we're just seeing this woman here is definitely on the gas pedal a little bit more. So what we want to help her with is adapting to stress in her life and to really find that balance between, so that her brain and nervous system can choose when she should be in fight or flight and when she should be in rest and digest, and being able to access that brake pedal much easier. The second scan that you're going to get when you come in for these scans is EMG. So what this is it is a neuromuscular test. So we are putting it up your back, and what it is showing us is where are you holding any neuromuscular tension, where you're storing your energy. So a lot of the times when we see yellow here in this area, this is where the adrenal glands live. I'm being regional here, so I'm saying about this, is this woman has been stuck on the gas pedal for so long that now she's kind of running out of gas. So it's like if you're taking a long trip and you never stop for gas, you're going to run out and stall, right? And that is what's happening in this scan when we see all of this yellow. She's also holding too much tension up here. So when you get scanned, we will personalize this exactly to your story. Chances are your scans are going to match what you're going through. They always do. And so this is a really cool scan because we also want to test this on fertility patients. Maybe they're having a hard time getting pregnant. It's probably because they don't have enough gas in the tank. Their brake pedal has not been on. And so they are having to, when your brake pedal's not on, your pathway of HPG, right? The hypothalamus pituitary gonads, or reproductive organs, isn't telling your reproductive organs to create that healthy progesterone or that healthy estrogen or to even ovulate. And so we need to get some gas in the tank here. The third scan that you're going to have is a thermography scan. So thermal, it's testing the temperatures from one side to the other and those differentiations. And so this one, really reactive here. We got a lot going on. We have blue here on the DTG. We will really go over these in your case, personalized, but what this scan really does show us is how is your autonomic nervous system functioning. So that means anything from that you don't have to think about: blinking, your heartbeat, your pumping blood, how are you detoxing? Those are all a lot of signs of the autonomic nervous system. And so this lady here was having a lot of trouble doing just those basic functions that she should be doing. Her body was working a lot harder at those. And so those are the 3 scans that we go over here in our office. And we really do feel that every single pregnant lady should be tracking their nervous system. So if you guys want to get scanned, go ahead and DM us, call our office. We would absolutely love to see you. And we want to show you how your nervous system is functioning. It really is cool to see. And most importantly, we want your nervous system to be ready to go into that marathon that we call birth and to recover postpartum. So if you guys have any questions too, feel free. We have an article that you can read on these scans. Feel free to head to our bio to read those, or just DM us. We would love to have a conversation with you, learn more about your story, learn more about your birth plan, and really see how your nervous system is functioning. All right, guys, I'm Dr. Allie, and I'll see you on the next video.